Now I'd like to request Dr. Poonam Joshi ma'am, Professor and Principal, College of Nursing, AIIMS Kalyani, to please share her expertise in role of nurse in mitigating intimate partner violence. Over to you, ma'am.
Just a minute. Let me share my screen.
Ma'am, I can present it, ma'am.
Okay, okay.
Yes, ma'am. You may please start presenting, ma'am. Your slide
Uh,
is.
yeah, okay. At the outset, I hope I am audible.
Yes,
Hello.
ma'am.
Yeah.
Yes, ma'am.
At the outset, I would like to thank the organizers, the organizing secretary, Dr. Ashish Pundir, and the chairperson, Madam Parmita, and AMA for giving me this opportunity to deliberate on role of nurse in mitigating the violence. As the previous speakers, the experts in today's panel, they have already deliberated a lot on IPV, intimate partner violence. It's a very significant health problem and a social care issue, which is having an epidemic proportion. And this is considered to be one of the prevalent forms of domestic violence, as it has been told to us by the previous speakers. Next slide, please. Intimate partner violence, it affects a significant number of individuals and families worldwide. And you will find there is, which is intersecting the cultural, religious, genetic, and ethnic boundaries. And most likely it is occurring in marital cohabitating, heterosexual as well as in same-sex relationship. The spouse could be a current spouse or a former spouse or just a live-in partner. And we have already understood the gravity of situation. It's the incidences are rising day by day, and as it was reported that 1 in every 3 women is likely to be affected with IPV. And but the problem is these episodes, they go unrecognized and underreported. Next slide, please. So prevalence in India, again, NCRB, according to NCRB, from the year 2020 to 2021, there has been a significant increase in the IPV, that is around 15%. And again, the reporting rate is relatively low. And the rate of reported dowry deaths and abatement to suicide is around 2% and 1% respectively in the year 2018 as per the available statistics. We have already understood different types of IPV which can happen to an individual. Could be physical, psychological, sexual. They are multiple body systems get affected, and they may come to the hospital. It could be the emergency department or could be OPD, any department like gynecology, pediatrics. If it's an adolescent, then it could be the medicine, psychiatry department. So they also present many times with musculoskeletal injuries and the burn injuries. Next slide, please. So impact is already well known, and it has a very devastating effect on the life of an individual. Various body systems are affected, and sometimes she can be pushed to death. And definitely there is also economic cost to the society because of intimate partner violence. Next slide, please. Now, as healthcare professional, what is our role? The nurses are going to be considered as very important team of the healthcare uh, team, and they are the important members, and they are the one who are coming in first contact with these patients. So their responsibility is to identify and to give the interventions and manage the IPV along with the other healthcare team members. They can provide the physical care, reducing their pain, suffering by being present with these victims. They can help in developing the trusting relationship, and maybe with the more trust the IPV victim has over the healthcare team, they are going to reveal their history, and they are going to seek help from the healthcare team members. And it's a very complex issue. There are so many complexities of IPV which we all need to understand, and we have to be sensitive to this issue. Many times it happens that we are working in a crowded OPD, there is too much of workload, we are underpowered, or sometimes you can also attribute it to the lack of knowledge and the positive favorable attitude towards these IPV victims. Offering the helping hands to these victims can be one of the reasons that we are not able to give them a timely appropriate help. Uh, as first line of support, the healthcare workers, including the nurses, they have to identify and they have to take the measures and do the appropriate referral if required. And before we talk about the management, it's all next slide. It is also our responsibility to participate in the society, in the community, by being present in the community as the responsible citizen of this society, the country. We have to ensure that we are sensitizing the people by organizing frequent educational sessions, taking the help of the influential adults, peers in the society. Um, our objective is to empower the women, making them aware of their rights, what are the options available to them, how to get out of this vicious cycle. It's very much true that, as the previous speakers have said, it is very hard to stay and more harder is to leave the relationship. So they require our support throughout. And once we have identified any victim, we need to do the regular follow-up, find out how she is doing, and making ourselves available all the time for help. And when these victims are reporting to us in the hospital, it is our duty to participate in history taking. At times, in the presence of the perpetrator, they may not be able to reveal the facts. So, in that situation, maybe ensuring confidentiality and privacy, taking them to the restroom, the detailed history can be taken. And ideally, the universal screening should be done as part of early identification. And there are a number of tools available, as it has been said. Hit scale is there, stat screening tool is there, and then danger assessment can be done, which is a kind of self-report a victim of IPV can be allowed to fill up, in which she is asked about the frequency of the incidents, the episodes, whether they are increasing in frequency, severity, and what are the other problems she's coming across. So these kind of questions can be asked by the nurses to the victims so as to get the detailed history. Next slide, please. So the role and the responsibilities are mainly to identify the abuse at the earliest, taking care of their physical health, whatever suffering they have. If it is a gynecological problem, we have to ensure that the gynecologist is called and the IPV victim is properly treated. Similarly, musculoskeletal injuries also need to be taken care of by calling the experts, and attending to women's safety, providing support, providing advice, and making referral. At the same time, it is important to involve the law enforcing agencies as well as um, the police in making this victim safe. Next slide, please. But it has been seen that many times as healthcare workers, as nurses, we do not come forward. We have seen in our day-to-day practice, as I can recall my previous experience when I was working in the emergency department, we used to identify the victim, but we could take care of their sufferings, we could relieve their pain, we could manage the injuries which they came with to us in the emergency department. We gave to some extent the psychological support, but after that we used to call the local authorities, the police, and then we used to think that our responsibility is over. But I was very much wrong at that time, and now I realize that our responsibilities are much more than just taking care of the wounds, suffering. Are also responsibilities to ensure health promotion, um, ensuring their rehabilitation, and making ourselves available all the time for their health. These are some of the anticipated barriers, but still, after identifying these barriers, still we need to make sure that we are there for extending our support to the victims. So these barriers could be the language barrier, like I am in the West Bengal right now. Many times I find it difficult to communicate, but still we are learning the language. And at times nurses they do, or the healthcare workers, they do not come forward considering their own safety. Who is there to support them and save them if they are coming forward to take care of the victim? So here comes the role of authorities. They have to make the healthcare workers also safe while they are working in the clinical area and taking care of the IPV victims. Similarly, the workload can also be redistributed. We can ensure adequate manpower in the healthcare settings, and any victim coming to us should be properly investigated, and we should call the experts for providing timely help. So lack of communication and collaboration between various stakeholders can consider to be the another important anticipated barrier. So as a conclusion, I can say that nurses can play a very crucial, very important, useful role in identifying and managing the intimate partner violence by providing person-centered care to these victims. Thank you so much.